We thought we knew a lot about crystal arthropathies such as gout until fairly recently, when seminal work by Jörg Chopp in Lausanne in Switzerland identified an inflammatory pathway through which monosodium urate crystals activate inflammatory pathways, leading to the cascade of inflammatory events that we recognize in our patients with acute gouty flares. Part of this work led to some key clinical investigations exploring the efficacy of existing anti-inflammatory drugs that could interrupt this pathway and have a major impact on this very often difficult to treat group of patients. Jörg Chopp teamed up with Professor Alex So in Lausanne and undertook some early pioneering studies to try and explore whether it was possible to interrupt this pathway. With me to discuss this is Alex So from Lausanne. Alex, thank you for joining us this morning. Tell us a little bit about the background of this story and how it evolved.
In about 2006, because Jörg Chopp and I were in the same university, we were discussing this finding that he made in the lab, in the test tube basically, looking at crystals and that cause inflammasome activation and IL-1 beta release. And the obvious clinical question at the end of the day is, can you actually inhibit or improve clinical inflammation by blocking IL-1 function or IL-1 targeting?
And it was timely at that point because there were already available drugs that were licensed for use in patients.
Exactly.
Tell us about that.
So the first idea that we had was that use the available drug, which is Kineret or anakinra, which is IL-1 receptor antagonist. And we did a small pilot study of 10 patients, which we eventually published, which basically showed that three daily injections of Kineret, anakinra, led to remarkably rapid resolution of pain and inflammation in these patients who basically had problems with taking non-steroidals or with colchicine because of side effects and because of medical contraindications.
And I guess the key thing here was that the patients didn't require chronic treatment. It was just 3 shots, effectively.
Right. This is actually, I have to underline that this is actually for the acute episode of gout. It doesn't treat hyperuricemia, obviously. But for patients who have difficulties getting a suitable treatment for their acute attack, this turned out to be extremely rapid, safe so far, and it worked in that initial pilot study in 100% of patients.
So in this particular study that you presented at this year's ACR meeting, you teamed up with another industrial partner, Novartis, to explore the efficacy of a different form of IL-1 blockade. Is that right?
That's right. So in this study, which was funded by Novartis, which was a phase 2 study, the initial aim was to look at basically if canakinumab, which is an anti-IL-1 beta monoclonal antibody, would actually be effective in relieving pain in acute gout. And we used different doses because we were trying to establish whether there was a dose range and the dose equivalence in comparison with a corticosteroid, which was given as an intramuscular dose.
And how's this given, this anti-IL-1 beta antibody?
This was given as a one-shot subcutaneous injection, so there were different doses which were given at the onset or right at the beginning of the acute attack of gout, again in patients who had contraindications to taking either non-steroidals or to colchicine.
And did it work?
Well, the results were remarkably good, and we were very, very convinced by the efficacy in terms of pain relief, which was rapid. And it was superior, in fact, to triamcinolone, which is the comparator. And the other thing which was very striking was that the one injection provided some sort of protection against further flare of gout for up to 2 to 3 months. So this was exactly something, this was not something which were designed to investigate in the beginning of the study, but turned out to be extremely interesting as well.
And which dose was most efficacious?
Well, the dose range that was tested went up to 150 milligrams as one subcutaneous injection, and this was the dose that was the most convincing in terms of pain relief and also protection against flares.
And how many of the patients that were given this treatment responded?
I think now that the response rate was in the order of 98%.
That's quite extraordinary. That's quite extraordinary. And in this particular study, you also looked at health-related quality of life outcomes,
right.
which are obviously crucial for these patients. How did they pan out?
Well, this was actually something we explored because nobody really knew how this sort of thing would change in an acute situation. And in gout, we know that quality of life measures are reduced, especially in chronic tophaceous gout patients. But in this acute setting, patients actually had lower quality of life, especially physical measures of quality of life at the outset, of course, related to pain particularly. And with the effective treatment, with the pain relief, this was very rapidly normalized to the so-called population norm. So they responded rapidly, and this was reflected in quality of life measures, both in terms of physical and mental measures.
And were these found to be superior to the triamcinolone injections?
This was not powered to be a statistically this was not a measure that we designed to analyze in a statistical way, so we didn't actually apply statistics to it. But we did see superior levels in terms of the scores in the canakinumab-treated patients compared to triamcinolone-treated patients.
So in your view, how would you see this form of IL-1 blockade in the treatment pathway of patients with gout?
Well, I mean, it is obviously effective in the treatment of acute attacks of gout. Now, one could question whether monoclonal antibody should be used for a person who comes in with a straightforward attack, which probably is overkill in terms of therapy. But in patients who have medical contraindications to taking non-steroidals, and there are lots of patients we found who basically could not take it because of renal side effects particularly, and also because of intolerance to colchicine. This is obviously the first group of patients who would benefit immeasurably from a specific therapy which acts on the cause of their problem.
And the safety profile is good too, I would imagine.
The safety profile has been, so far in our studies, good, but as you know, the canakinumab has been used also in other medical indications, and so far I think the collective experience has been globally very satisfactory in terms of safety from infections and other adverse events. So I think that looks so far promising.
And you mentioned other indications. What's your personal view and experience on the use of these IL-1 blockers in other crystal arthropathies?
Well, the main other condition is pyrophosphate arthropathy or pseudo-gout. And there are a couple of case reports showing that anakinra is effective in those 1 or 2 patients which have been tested in this sort of situation where they failed all other therapies. And those studies and no trials have been done so far, but I think that this will come along progressively, and I think it should inhibit, at least the IL-1 blockade should inhibit the inflammatory phenomena associated with all forms of acute crystal arthritis.
So a real breakthrough for gout and pseudo-gout sufferers, I would see.
I hope so.
Fantastic. Alex, thank you so much for coming and joining us and telling us about these studies.
Thank you, Andy.